Warm welcome to the latest OncoShorts podcast, brought to you by MedSynapse. OncoShorts is a weekly program covering a wide range of clinical and scientific medical content that offers enriching insights into the world of oncology. Listen to our today's podcast episode, which focuses on the results of the trial titled Chemotherapy with or without Avelumab, followed by Avelumab maintenance versus chemotherapy alone, in patients with previously untreated epithelial ovarian cancer, that was published in September issue of the Lancet Oncology. Ovarian cancer is a heterogeneous disease, wherein most tumors are epithelial ovarian cancers. It has been observed that, although most patients with epithelial ovarian cancer respond to frontline platinum-based chemotherapy, around 70% will relapse within 3 years. Although not considered a strongly immunogenic cancer, epithelial ovarian tumors are characterized by immunological activity. Studies have noted that the PD-L1, a key suppressor of T cell function, is expressed on ovarian tumor cells and tumor-infiltrating lymphocytes in more than half of patients. This clinical trial discussed role of Avelumab, an immunotherapy drug, in blocking the PD-L1 protein expressed by tumor cells. This randomized, Phase 3 trial, Javelin Ovarian 100, was conducted at 159 hospitals and cancer treatment centers across 25 countries. The main aim of this trial was to compare Avelumab in combination with chemotherapy versus chemotherapy alone in patients with treatment-naive epithelial ovarian cancer. Patients above 18 years of age and with stage 3 or 4 epithelial ovarian, fallopian tube, or peritoneal cancer were included in this study. The primary endpoint was progression-free survival, assessed by blinded independent central review in all randomly assigned patients. The median follow-up progression-free survival for all patients in this trial was 10.8 months, 11.1 months for the Avelumab maintenance group, 11 months for the Avelumab chemotherapy combination group, and 10.2 months for the chemotherapy control group. For the patients with Avelumab maintenance, median progression-free survival was 16.8 months, 18.1 months with Avelumab chemotherapy combination treatment, and was non-estimable, NE, 18.2 months, with control treatment. There were several adverse events observed during this trial. Anemia was noticed in 21% of the Avelumab maintenance group, 19% in the Avelumab combination group, and 16% in the control group. Other common adverse event noticed was diarrhea, which was observed in at least 3 patients in all of these groups. Neutropenia count was 28% and 30% and 26% respectively for Avelumab maintenance group, Avelumab combination group and control group. Neutrophil count decrease was 15%, 14%, and 18% for Avelumab maintenance group, Avelumab combination group and control group respectively. Study concluded that the use of Avelumab as the frontline treatment setting is not a good alternative in patients with untreated epithelial ovarian cancer. No significant changes were noticed for Avelumab administered in combination with and following chemotherapy or as maintenance therapy alone. This concludes our today's OncoShorts podcast, brought to you by MedSynapse. Thank you for listening.